Good morning. How are you feeling today?
Good morning, doctor. I'm really not feeling well lately. For the past week, I've been experiencing severe headaches that just won't go away. They seem to be getting worse, and I'm starting to worry. The pain is intense and constant, making it difficult for me to concentrate or go about my daily activities. I've tried over-the-counter pain relievers, but they don't seem to be helping much. I'm hoping you can help me figure out what's going on, and find some relief.
I'm sorry to hear that. Can you describe the headaches for me?
The headaches are throbbing and typically start in the afternoon. Once they begin, they persist for the rest of the day, lasting until I go to bed at night. The throbbing sensation is quite intense and it makes it hard for me to focus on my work or enjoy any activities in the evening. It's becoming a significant disruption to my routine and affecting my quality of life.
Have you noticed any triggers, such as certain foods, stress, or lack of sleep?
I think stress might be a significant factor contributing to my headaches. Work has been extremely hectic lately with tight deadlines and a lot of pressure to perform. I'm constantly juggling multiple tasks and it's becoming overwhelming. The stress from work seems to be taking a toll on my health, and I can't help but feel that it's linked to the severity and frequency of my headaches. It's been difficult to find time to relax and unwind, which I believe is exacerbating the situation.
I understand. Have you experienced any other symptoms like nausea, vision changes, or dizziness?
Yes, sometimes I feel nauseous and a bit dizzy, but no vision changes.
Are you currently taking any medications for the headaches or any other condition?
I've been taking over-the-counter painkillers, but they don't seem to help much. I'm also on medication for high blood pressure.
All right, how long have you been on the blood pressure medication?
For about 2 years now.
Have there been any recent changes to your dosage or any other new medications?
No changes recently.
Okay, let's check your blood pressure and do a quick examination. Your blood pressure is slightly elevated. Given your symptoms and history, I recommend we do some blood tests and perhaps a CT scan to rule out any serious issues.
That sounds like a good plan. What can I do in the meantime to alleviate the headaches?
Try to manage your stress levels. Regular exercise, staying hydrated, and ensuring you get enough sleep can help. Also, avoid excessive caffeine and maintain a balanced diet.
Thank you. I'll try to follow those suggestions.
You're welcome. We'll schedule the tests and follow up once we have the results. Please don't hesitate to reach out if your symptoms worsen.
Good afternoon, Mr. Smith. How are you feeling today?
Good afternoon. I'm doing okay, but I'm still feeling some pain at the surgery site.
That's understandable. On a scale from 1 to 10, how would you rate your pain?
I'd say it's about a 6.
Are you taking the prescribed pain medication?
Yes, I'm taking it as directed, but it doesn't seem to last long enough.
I see. Have you noticed any side effects from the medication?
Just some mild nausea.
How is your incision site healing? Have you had any issues with it?
It looks fine to me. No redness or swelling, but it's still quite sore.
That's good to hear. Are you able to move around and perform daily activities?
I can move around a bit, but I get tired quickly.
Make sure you rest and avoid strenuous activities. I'll speak with the doctor about adjusting your pain management plan. We want you to be comfortable while you heal.
Thank you. That would be helpful.
You're welcome. We'll also schedule a follow-up appointment to check on your progress.
All right, thank you.
Take care, Mr. Smith. We'll see you soon.
Our new diabetes management program, Healthy Living, focuses on educating patients about managing their condition through diet and lifestyle changes. The program includes individual counseling, group workshops, and cooking classes that teach patients how to prepare healthy meals. We've seen great results in pilot groups, with participants showing improved blood sugar control and better overall health. We'll be rolling out this program hospital-wide next month, so your participation in promoting and supporting it will be essential.
To enhance our team's flexibility and skill set, we are introducing a new staff rotation policy. This policy will require staff members to work in different departments on a rotational basis every 6 months. The goal is to provide you with a broader range of experiences and improve our overall service delivery. We understand this might be an adjustment, so we're offering support and training to help you transition smoothly. Your cooperation and feedback will be crucial to the success of this initiative.
When discharging a patient, it's vital to review the discharge summary with them and ensure they understand their medication instructions and follow-up appointments. Double-check that all necessary paperwork is completed and that they have a copy of their discharge instructions. If the patient has any questions or concerns, address them before they leave. Lastly, make sure to update their status in the electronic health record system to indicate that they have been discharged.
This is the new 3D imaging system we've just started using for breast cancer screenings. It provides clearer images and helps us detect abnormalities at an earlier stage. Before beginning the procedure, ensure the patient understands what to expect and is comfortable. Always follow the positioning guidelines carefully to get the best images. After the scan, review the images for any immediate concerns before sending them to the radiologist for a detailed report.
Our department has been selected to participate in a new research study on the effects of a plant-based diet on heart disease. We will be recruiting patients who meet the study criteria and monitoring their progress over 6 months. Each patient will receive dietary guidance and regular checkups. The goal is to gather data on how a plant-based diet can impact cardiovascular health. Your cooperation in identifying eligible patients and assisting with data collection will be essential for the success of this study.
Starting next month, we'll be transitioning to a new electronic health record system. This system is designed to streamline documentation and improve the accuracy of patient records. All staff members are required to complete the mandatory training sessions scheduled over the next 2 weeks. The training will cover how to enter patient data, access records, and utilize the new features. Please make sure to attend one of these sessions to ensure a smooth transition.
Hello, I'm Dr. Emma Clark, a clinical psychologist specializing in stroke rehabilitation. Today, I want to share some insights into my role and discuss the case of one of my patients, whom I'll call John, to illustrate the kind of work I do. Firstly, let me provide some context. Stroke is a leading cause of long-term disability, and it can have a profound impact on both the patient and their family. My role involves supporting patients through the emotional and psychological challenges they face after a stroke. This support is crucial because, alongside physical recovery, managing the psychological effects is vital for overall rehabilitation. Now, let me tell you about John. John suffered a stroke about 6 months ago. Initially, his physical recovery was slow, but he made progress with the help of physiotherapy. However, it became clear that he was struggling with significant anxiety and depression, which are common among stroke survivors. John often felt overwhelmed by the changes in his life and the uncertainty about his future. During our sessions, we focused on helping John manage his anxiety and improve his coping strategies. We used cognitive behavioral therapy techniques to address his negative thought patterns and help him set realistic goals for his recovery. John also expressed frustration with his new limitations and difficulty adjusting to his changed role in his family, which led to additional sessions focused on family dynamics and support. It's important to note that stroke recovery is a multifaceted process. For some patients, the emotional impact of their condition can be as challenging as the physical symptoms. Many patients experience feelings of grief and loss, and they might also struggle with changes in self-esteem and identity. These emotional responses can significantly affect their overall recovery, which is why addressing them is a key part of rehabilitation. Our clinic provides a range of psychological support services, including individual therapy, group therapy, and family counseling. We find that having a comprehensive support system helps patients like John navigate their recovery more effectively. The goal is to help them regain confidence, improve their quality of life, and support their integration back into daily activities. In summary, the work of a clinical psychologist in stroke rehabilitation involves not only supporting patients through their emotional struggles, but also working with their families to provide a holistic approach to recovery. The aim is to foster resilience and adaptability, enabling patients to lead fulfilling lives despite the challenges posed by their condition.